My name is Dr. Dudley Burwell. I'm an orthopedic surgeon. I've been in practice here on the coast since 1987, working on my 35th year, and I do general orthopedics, but I've been doing this so long, my practice specialty has basically narrowed down to hip and knee replacements mostly. And there have been some developments in the last few years that have really helped with those replacements.
My name is Herman Jones. I'm 68 years old. I am a total knee replacement patient for Dr. Burwell. And I initially came to him because I was having so much pain. And I was told that the injections would work temporarily, and every 3 months I could go back and get the injections. But when I actually saw the, my knees, when Dr. Burwell showed them to me, I realized I was bone on bone. I needed a total knee replacement. And I was told at that time about this new technology called Iovera.
Iovera is a very new development that's helpful with the knee replacement surgery. It's helpful with the post-operative pain, and one of the things that we deal with is trying to make patients better, but also make their pain tolerable after their big procedure. Well, now with the development of Iovera, the knee replacements can be just as easy, if you will.
So I went ahead and went with that. It's a 2-week injection that takes place 2 weeks before the surgery, and it actually lasts 9 months.
It's a development that allows a pain management doctor to actually produce sort of a freezing effect of the nerves around the knee so that those nerves are asleep for a period of 6 to 12 weeks. And during that 6 to 12 week period, we do the knee replacement, and then their post-operative course is a lot less painful than it would be naturally. And those patients can do their therapy more comfortably and get their range of motion back. And then slowly, as the nerve wakes back up, they get their feeling back around the knee.
So I went ahead and had it done, and honestly, I have to say that after the surgery, in both cases, it absolutely did speed along my recovery. And I'm back at work, and I'm, actually pain-free.
Pain management is what we're trying to accomplish, is getting patients better with surgery, in this case, without getting them addicted to a pain medication after the surgery. And this allows us to give them less pain medication, or the patient need less pain medication during their post-operative course.
I recommend it every day. When I talk to different ones that's about to have knee surgery, I tell them, look, or any other joint surgery, I say, look, you really need to look at the Iovera.
I recommend this treatment because the knee replacement surgery itself can be a very painful procedure, and different people have different levels of pain after the procedure. When I explain to somebody about knee replacement and I tell them that it's painful, this is a good way that I can tell them we have additional ways of relieving your pain after the surgery so that you won't need as much of the narcotic pain medication.